Afternoon, everybody. I hope everybody is feeling well at home. First time I've done an online presentation, so forgive me if it's a bit disjointed, but hopefully it will go okay. My name's Hannah. I'm a registered dietitian at Untitled Nutrition. So today we're going to be covering just some general advice, looking at who is most at risk in the coronavirus pandemic, look at some healthy eating, a few tips and meal ideas, some information about staying healthy and your mental health as well. I'm just going to touch briefly on food security and our vulnerable population, and some specific health conditions as well. There we go. Some coronavirus guidance. Dietitians have been asked lots of questions about nutrition and dietary issues related to the COVID-19 and the coronavirus pandemic. So I've tried to put most of those within this discussion. But if you have any additional questions, please do ask. And if I don't know the answer, I'll find out and I can always email it to you. The most important thing is to follow the guidance given by our government. It's slightly different in each jurisdiction, but locally this includes staying at home unless you absolutely need to go out, following the social distancing guidance, washing your hands regularly and not touching your face. And most of all, remember that you can spread the virus even if you don't have symptoms. So even if you feel okay, you still need to be staying at home and not spreading that. There's lots of people around online and on social media, and we are all stuck at home sitting on social media, getting all this unsourced advice about the supplements and the foods, miracle cures that are going to prevent us from getting COVID-19. And as dietitians, we are here trying to make sure that the information that we're giving is evidence-based and fact-checked. With that in mind, you'll see the disclaimer up there as well. It's important to note that we are dealing with a new virus, so the information may well change over time as the researchers study this and as they learn more. But the information that I'm giving today is the most up-to-date that I have currently. The questions that we're being asked include things like, does the new coronavirus affect only older people, or are younger people also susceptible? And it's important to note that people of all ages can be infected by the new virus, but older people and people with pre-existing medical conditions do appear to be more at risk. And that includes things like asthma, diabetes, heart disease, other chronic diseases. And what we found out this week when we've done some telephone consults with some of our clients is some of them who are in those at-risk categories don't realise they're in the at-risk categories. So we're trying to ensure that everybody is doing what they can. The World Health Organization is advising people of all ages to take steps to protect themselves from the virus, using good hand hygiene and good respiratory hygiene. And some of the people who are considered high risk of COVID-19, I think we're a couple of slides on, Taja. There we go. I've listed a few of them here. People who are more at risk of suffering a severe illness should they contract the COVID-19, people who have respiratory illnesses, people with poorly controlled diabetes, as I mentioned, people with cardiovascular disease, heart failure, kidney disease, people with weak immune systems, people with lung conditions, people who are older as well, and people who are pregnant are thought to be more at risk, but there are special considerations for breastfeeding as well. We'll touch on that a bit later. Important to note from that that list of people who are at risk is in our population. We do have a aging population, and we do have a population with quite a lot of chronic disease. So we do have a number of people who will be considered high risk. In terms of healthy eating, it's important to make sure that we continue to eat healthily while we are staying at home or if we're quarantined. All the usual advice that you see coming from your dietitians and from your healthcare providers still applies. And in fact, it's probably more important at this time because of the stress and anxiety And it just takes a little bit more planning since we are all kind of stuck at home. In addition, we want to make sure that we have optimal nutrition to make sure we're in the best place to fight off the virus should we become infected, which of course we all hope that we're not going to be. So the general normal healthy eating advice applies. This is our local guidelines, the nice Eat Well plate, which hopefully you guys are all familiar with, showing the balance of meals, making sure you're getting all your lean proteins and your starches, your vegetables, your dairy and your fruits. And typically the advice is ensuring you have 5 portions of fruits and vegetables each day. And remember in these times that it's not just fresh fruits and vegetables that count, it's also your frozen, your dried, your canned, will all count towards your total 5 a day. Potatoes, breads, rices, pastas, cereals are all your starchy carbohydrates, and it's important to include small portions of whole grain starchy foods with each of your meals. Bear in mind that if there's specific advice for your medical condition, you need to be following that. Aim to choose one food that's slightly starchy at each meal, and eat regularly. Make sure you've got a variety of different foods, different fruits, different vegetables, different colors on your plate to make sure that we're getting as many different vitamins, minerals in our diet. Also fiber and antioxidants. And then in terms of proteins, again, another good variety of proteins, including beans and pulses, including meats, eggs, fish, and other sources of protein. Keep it healthy, trim your fat off your meats, try and avoid frying where you can, making sure we're eating 2 portions of fish each week, and ideally at least one of those should be an oily type of fish. And try and have a couple of meat-free days each week. There's a lot of research been coming out over the past few years about the importance of plant-based foods. And then lastly, the dairy or alternatives. So dairy foods providing calcium, but there are alternatives out there if you do have a dairy intolerance. So a few tips for planning in this time. Try and make sure you plan your meals ahead of time so that you're able to shop for these items. Shopping is one of the few things we are allowed to go out of the house for, being mindful of social distancing. Planning your meals helps you to create a healthier meal plan for your family, also helps with budgeting, minimizes overbuying and reduces snacking. If we don't put the snack items in our basket, then we can't be eating them. Write out the menu so everybody knows what to expect, everybody knows what meals are coming, so that people don't eat the food that you've planned for dinner as a snack, which happens in my house sometimes. Add vegetables to all the dishes that you cook in as many different ways. So putting your carrots and onions in your stews, putting your tomatoes, maybe some mushrooms, olives in your pasta sauces, adding extra vegetables when you're doing soup. For those of us who have children at home, put them to work, call it home economics classes and have them chop up the vegetables for you. Watch the salt. Of course, we're sometimes buying things that are going to last a little bit longer because we don't know how long we're going to be stuck at home. But do check your labels and make sure that you're choosing the lower sodium versions of foods, especially if you have high blood pressure or kidney disease or something like that. And make the most of the extra time at home. Try some new dishes, look at your recipe books, so next time you do need to go to the store, you can make something a little bit more different. We've got plenty of time to be chopping those vegetables, chopping those different meats, trying out different things. So, try and find the silver lining in the cloud and try some fun new foods. Just a few easy meal ideas. These are things that often that we would throw together. Things that are easy whilst you're in isolation or if you're in quarantine. Things like fish cakes we all like. We're coming up to Easter. Things like using salmon instead of the salty codfish. Even if you've soaked your dried codfish really well to get as much salt out as possible, it still can be quite salty. So try and maybe use something a little healthier like some salmon or something instead. And you can even use canned salmon, so that's fine too. Making pasta bakes, everybody likes pasta bakes. Making sure you're including a lean protein and some vegetables, and maybe serve with a little bit extra vegetables or salad. if you're making soups, maybe add some extra lentils or pulses to them to boost the nutritional value, improve the fiber content and the protein content. And then another idea, maybe some stir fries. You can mix those up, create all different types of stir fries with different types of veggies and lean proteins, and see what's available in the store. Not everything is available all the time at the minute, so you may be forced to try something slightly different. Avoid all, as much as you can, the sugary foods and the highly processed foods, because these are not going to be the most nourishing things that you can be eating, and they can be linked to increased inflammatory response. And in a highly stressed situation to start with, we don't really want increased inflammation. Snacks. I did touch upon snacks before. Try not to buy too many snacks. If you know that you will be tempted to eat something that you shouldn't, then don't buy it. I know for myself, if I've got some chips in the house, I am going to eat them. My husband, on the other hand, can buy some snacks and he's not bothered. He'll just leave them in the cupboard. Be aware of boredom eating, stress eating. There's a lot of us at home. Our children are at home and seem to eat more food at home than they do when they're at school. So we'll all be bankrupt by the end of this anyways. In terms of fluids, making sure that we're having enough to drink, as we all know, is really essential for good health. If you do pick up an infection, you are going to need more fluid to help your body deal with that. As a rule, adults usually advise to have about 8 cups or large glasses a day, but if you do have a fever, this may need to be more. In terms of healthy eating, try and stick to water as your main drink. Avoid sugary drinks and avoid caffeine if you have a tendency to become anxious. These are stressful times. Then we've been looking at how much should we buy. A lot of people have been saying, how much should I stockpile? How much should I keep in my cupboards? There's no real need to stockpile. There's no need to buy much more food than you would normally. Buying a few extra items is fine, but we do need to make sure that the stores are able to keep up with the demand. And from speaking to the staff in the supermarkets, what they're telling me is it's not that they don't have the food there, it's not that they don't have the supplies there, it's just that it's going off the shelves so fast that they can't keep them stocked. But they do have the food in the back. We can still go to the supermarket if we need to go to the supermarket to buy food. We're not anticipating any shipping disruptions, according to the government, that would lead to any food shortages. So the issue right now is that we're just buying too much. If you are sick, if you need to self-isolate, in most cases it should only be sort of fairly short-lived, only a few weeks. So we don't need massive amounts of food. I can hear somebody's speaker.
Can you hear now, Hannah?
I think so. Yes, there we go.
Okay.
I was hearing somebody crashing around.
Yes, you're saying.
So in these times, I think it's really important to make sure we know what we've got available locally. We know we should be supporting our local businesses all of the time, but I think this is a time to really take advantage of the local businesses. The farmers and the farmers markets are able to provide fresh fruits and vegetables. You don't have to worry about any shipping issues. And in fact, I saw a Facebook post just not long ago with one of the local farm stands saying, yeah, we will be there. You can call ahead. We'll have everything ready for you. As you know, there's lots of supermarkets and businesses that are offering home delivery and curbside delivery. So we can keep using our local businesses. Using the local farms, of course, means that your fruits and vegetables are super fresh. So you're going to be getting the maximum nutrition out of those foods. It does make sense to stock up on a few extra items, and like I said, no need to panic buy, but adding a few extra things each time you go shopping is a good idea. And that means that if you do become unwell, if you do get a fever, then you can stay at home and you won't be needing to go to the supermarket. Good options to keep in the cupboards are things like your dried foods, like your lentils and your rice, your pastas, some of the canned foods like canned tomatoes and pasta sauces that can be used in multiple ways. Frozen and canned vegetables and beans, or even dried beans. Dried oats are a good store cupboard item. And then, as I mentioned earlier, canned fish is a good choice, and even frozen chicken pieces. And then you can buy some fresh stuff and freeze that too. So things like bread and milk freeze really well. I have a few children in my house, so we have a few extra cartons of milk that we have frozen just in case. So making the most of the food you buy, we don't want to create any waste. So using up your fresh ingredients first. So the items that last less long. I'm not sure that's a sentence. Things like your lettuce and your foods that tend to spoil faster. Know what keeps the longest. So some of the things that keep a bit longer are things like your onions and your potatoes and your sweet potatoes, especially if you keep them in a dark cupboard. You don't need to put those things in the fridge, but just keep them somewhere cool and dark if you can. Have a look through your cupboards. I've done this week too. Tidy up with your kitchen cupboards, find those items at the back of them. You may come up with some inspiration to use them up. If not, it's a good opportunity to clear them out and pass them on to a friend, or donate them if there's something that other people would want to eat. That's not to say give the food banks all your junk. That's to say if there's food items you're not going to use, then perhaps they may appreciate them. And if you do get sick, it's worth having a few easy to cook, easy to prepare foods in the house just on standby. Some soups that you've made already, or some of the microwave whole grain rice that's just a few seconds in the microwave, or some pre-prepared meals that you've got that are frozen, so that when you're not feeling very well, you are able to still have a proper meal. Another question we're getting asked are things about food safety and the COVID-19 transmission, and there really isn't any evidence right now to suggest that COVID-19 is being transmitted when handling and preparing foods. So just follow your normal food safety advice: washing your hands, washing your surfaces, separating your raw meats and fishes from other foods. Now, the big question we get asked is, can I boost my immune system through the diet? And I've done a few searches on this over the last few days before giving this presentation. And simply, you cannot boost your immune system through the diet. There's no specific foods or supplements that will prevent you from catching this virus. Good hygiene remains the best means of avoiding infection. That said, there are many nutrients that are involved with normal functioning of the immune system. So we need to make sure that we are well nourished so our immune system is, playing its best game here. Specific nutrients that support our good immune system are things like iron and zinc, copper, folate, some of the B vitamins, vitamin C, vitamin D, and we need to ensure that we are eating a good variety of foods in order to get all those nutrients and to get a balanced diet. Another question we're getting asked quite a lot is, should we be taking vitamin D supplement? More and more people are interested in taking individual vitamins and taking supplements. And vitamin D is an important supplement. It helps keep our bones healthy, our muscles and our teeth. It protects our muscle strength. We normally get our vitamin D from sunshine, not food, which means that you need to be getting outside into the sunlight, even if you're eating a pretty good diet. And even if the rest of your diet, provides you with all of the other vitamins and minerals, you still need to be getting some vitamin D. Now, the issue is right now, if we're all staying indoors, if we're staying in quarantine, if the sun is weak, like it has been over the last, few months, being since winter time, our vitamin D stores may be a little lower. So in those circumstances, we may benefit from a supplement of vitamin D. if you can, depending on how your house is set out, if you can get outside a little bit, if you can sit on your balcony, if you can sit in your garden, keeping in mind your social distancing, then do that. It's good for your mental health and your mood to get outside a little bit as well. But if you can't get outside, then do consider getting a vitamin D supplement, or if your multivitamin contains vitamin D, that would be fine too. If you want to focus on your diet and getting the vitamin D, oily fishes are rich in vitamin D, egg yolks, meats, milk, offal foods like liver and kidneys and stuff. And some of the European breakfast cereals are fortified with vitamin D, as is infant formula and some of the yogurts that we can buy. Now, we touched upon earlier the sort of stress and anxiety that these situations can create, and some people already have depression and anxiety and stress in their lives. So it's understandable that in these kind of situations, people are going to feel more anxious and upset, and it's very important that we look after our mental health as well as our physical health. As a good rule of thumb, eating a good healthy diet, plenty of fruits and vegetables, the whole grain foods, protein foods, include your oily fish, are going to be good for helping support your mood. Making sure our diet contains a wide variety of proteins and vitamins and minerals to support the body functions. Making sure we're eating at regular times to keep our blood glucose levels stable, and this can have a positive impact. Some specific nutrients there for mental health include things like selenium, which we can find in nuts, particularly Brazil nuts, in seeds, in wholemeal bread, and in our meats and fishes. Iron, particularly from meat sources, but also from beans and pulses and fortified cereals. Thing to note with iron is try and avoid drinking your tea at the same time as you're having your iron, because tea can inhibit your absorption of iron. The different B vitamins are also essential for good mental health. And again, as mentioned earlier, some of these are in the fortified foods and in the animal protein foods as well. And folate is probably the last really important one in terms of mental health. You're looking for things like your green vegetables, your citrus fruits, beans, and again, your fortified cereals. Now, one thing to look for amongst our friends and our clients and our neighbours is food security. And in these times, there's a lot of people who are suddenly finding that they don't have as much income as they used to. They're either going, reduced hours, they're being laid off, or they're losing their jobs completely. And it's a pretty stressful time. Food security in this situation, or food insecurity, I suppose, can happen very quickly, and it may be a person or a family who was doing absolutely fine a few weeks ago, and then suddenly nobody has a job. These people may not ask for help. They may be hoping for the best. They may be worried to tell people. They may be embarrassed to tell people. So please keep an eye on your friends and your families and your neighbours. And if you do see anybody struggling, or you hear through the grapevine that somebody, perhaps, has lost their job and things are going to be a struggle, then perhaps drop them off something. Take them a casserole. Leave it on their doorstep. Offer them some help. Remind them to seek out the food banks as well if things are really challenging for them. In addition to these new people with food insecurity, there's also our vulnerable population, and it's important to think about people who are elderly, isolated, considered to be high risk, those people who are more vulnerable to malnutrition, and those people who are struggling to get to a supermarket. And people often wonder why I talk about malnutrition a lot, but malnutrition is actually more common than we realize, and it can be hidden, especially if people are staying in their own homes. If they're elderly, people sometimes expect older people to lose weight, or sometimes if somebody's overweight and they lose some weight, people think that's a good thing, but if it was unintentional, then that's not a good thing. Some things to ask ourselves is, can these people access supermarkets and food outlets? Can they get to the supermarket have they been isolated? Do they need to remain at home? If they're elderly and high risk, probably they need to stay at home anyway. So is anybody going to the store for them? Were they previously relying on public transport to get to the grocery store? Because of course, right now we don't have any public transport. And they may not be able to walk as far as the nearest store. Do they have enough food and drink in their house to meet their nutritional needs? So if you can find out what they have, that's really useful. Have they got access to the good foods? Sometimes when people are vulnerable and they get food donations, sometimes that food is not of the highest nutritional quality. So make sure that, when we're donating foods or giving people foods, we're giving them good stuff. Have they got a store cupboard full of foods? Have they got any pre-prepared foods for when they, if they become unwell? Can we link them in with local support like the Meals on Wheels or the food banks? Meals on Wheels, I believe, are looking for volunteers if anybody's up for it. They need some drivers and some staff for their kitchen. And can we also help reduce some of that isolation? Can we give them a call if these people are older? Perhaps they don't have, the internet. They're not on social media. So just a simple telephone call to them to brighten their day and reduce that social isolation can have a big impact. And actually has a big impact upon how they eat and their nutritional intake as well. So it's not just their mental health. In terms of malnutrition. It is important to consider malnutrition. Malnutrition is quite a serious condition which increases someone's risk of infection. And if somebody does get unwell, it slows down their recovery. It's more common in people who are older, people who are or who have been unwell, people who live in care homes, and those people we just mentioned who are already socially isolated. And the addition currently of the social distancing makes people even more isolated. It's really important that we keep a check on these people. Unintentional weight loss due to disease or infection is not good, whatever somebody's original body weight was. Like I said, if somebody's overweight and they lose a bit of weight, we all say, oh, wonderful, you're looking fantastic. But actually, if they lost that because they weren't well, it's not a good thing. It's not a good indicator for their health. Good nutrition, including eating enough protein, is really important to protect people's muscles, and that includes the respiratory muscles, which are helping with breathing, and that's going to become really important if these people do catch this COVID-19 virus. As we mentioned earlier, vitamin D is also important, especially because they're probably not getting out very much. In terms of specific health conditions, I've just got a very brief run through of a few of these health conditions that put people more at risk that we did mention right at the very start. In people with certain health conditions, they are more at risk of developing complications if they were to catch this virus. So a few key health conditions that are relevant to our population here is, what are we doing what should you do if we're living with diabetes? And I think everybody who has diabetes, whichever type of diabetes, is more at risk of severe complications if they do develop coronavirus. And it's really important to make sure you're managing your blood glucose levels at this time. So, seek help from your dietitian, from your diabetes nurse, from your physician, from whomever your healthcare provider is, and make sure that you've got your individualized plan for managing your diabetes. For those people with celiac disease, it's really important they continue to maintain a gluten-free diet, even in these times of self-isolation and quarantine. It is a little more challenging sometimes when the stores are low in stock, because the gluten-free foods are often in short supply to start with. But celiac disease does put people at slightly higher risk of severe complications. Other persons, maybe what should we do if we're living with Crohn's disease or ulcerative colitis. If you do have one of these conditions and you are on a special diet, then you need to be making sure you're following that diet. Again, these could be a little bit more challenging when the food supplies aren't there in the store, and these are people who maybe need to buy a little extra just to make sure they've got the right types of foods in. Some of these clients may be taking immunosuppressive medications, and that really would put them in a high risk category because that reduces their immune system. Again, if anybody is concerned, they need to speak to their healthcare provider. Another common issue in Bermuda is kidney disease. If you do have kidney disease, it's essential that you follow your individualized renal plan, which was provided by your dietitian or your healthcare provider. Now, everybody with kidney disease should have an individualized renal diet. Two people with kidney disease will probably not be on exactly the same diet. It's very individual, so what's working for one person may not be appropriate for the next, and that's important to remember. Couple of key points though for everybody with kidney disease is being mindful of the salt intake and being mindful of the amount of processed foods that we buy. So again, not stockpiling these long life foods that are often higher in salt and phosphorus. What should we do if we have cardiovascular disease such as high blood pressure, high cholesterol, or if we've had a stroke? There's other things within the cardiovascular disease group, but they're the sort of common ones that we see. Again, we need to make sure we're following the therapeutic diet by a dietitian or healthcare provider, making sure we're having plenty of fruits and vegetables, avoiding processed foods, watching our sodium intake, and choosing the heart healthy fats, and taking all the standard precautions. And the last couple of things really are sort of food allergies. What if you or your child has food allergy? Again, the specialist products are often limited supply to start with. So, right now, some of these food items are not readily available, but hopefully, as soon as people settle down and reduce the panic buying, these food items should be back on the shelves. It may take a little longer to shop because you're going to have to read your labels carefully if your usual products are not available. Make sure that you're following the guidance provided by your healthcare professional. Sometimes in this climate where the foods aren't readily available, it does perhaps mean you'll be eating a more limited range of foods, but if it's only in the very short term, it won't cause any harm at all. If you are concerned, then consider a multivitamin and mineral supplement. If you're struggling in the longer term, again, reach out to your healthcare professional. I did mention that we would touch on and sort of breastfeeding and formula guidelines. Currently, there's no evidence that the virus is carried in breast milk, so it's thought the benefits of breastfeeding are going to outweigh any potential risks of transmission through the breast milk. But the main risk really is that the social contact between you and the baby, and the sharing of the airborne droplets with the virus in it. You perhaps want to discuss the pros and cons with your family and your healthcare team, but realistically, if you want to continue to choose to breastfeed your baby, then make sure you're washing your hands before you touch the baby or your pump or your bottles. Try and avoid coughing and sneezing on your baby while they're feeding, or anytime really. Some places are recommending wearing a face mask whilst breastfeeding, but I think this would only be if you actually are unwell. Follow recommendations for your pump cleaning after each use. And of course, if you're using your formula or express milk, make sure that you are really diligent in terms of the sterilization guidelines for your particular pump or your bottles. And if you're in the hospital, make sure that you're using, or anywhere actually, you're using a dedicated breast pump, so you're using one that's used for you and you only. You're not sharing these things between people. So the last thing really is, what if you do get sick? There's always a possibility that you may become sick. Hopefully you won't, but you could just catch a cold while you're in the house anyway. So hopefully you'll only experience mild symptoms, but plan ahead. Make sure that you've got some easy to eat foods in the house already, or easy to prepare foods in the house. Things like soup, stews, casseroles are usually good choices when we're not feeling very well. If you are self-isolating, if you have symptoms, then you need to make sure you are maintaining your good nutrition and hydration, and make sure you're eating and drinking regularly, even if you don't feel like it, even if you do have a poor appetite. You really need to make sure you're keeping your strength up to be able to fight the virus, really. If you do have any specific nutrition needs, then as I said before, speak to your healthcare provider. You may have to ask friends and family who are going shopping to get you specific foods, and they may need to know that you have a particular health issue as well, so that they're able to make good choices for you when they're doing your groceries. And that's all I have to say right now. Just a reminder that it is an ongoing situation. Things are going to change over time, so don't shout at me if I change my mind in a couple of weeks about a few of these things. But all your healthcare professionals are reading the research, keeping up to date, so you should have good faith that people are, if you go see your physician or your dietitian, you should get good advice. And the key message is really eat a healthy diet, stay at home, follow your social distancing guidelines, wash your hands, and don't touch your face. And remember that even if you don't have symptoms, you can still be spreading the virus. Thank you very much.
Thank you, Hannah. I know that nutrition is not an easy subject to discuss, especially when we have our particular cravings for certain foods, especially when you're stressed during this time.
Yeah.
So providing the input is very helpful. Does anyone have any questions that they would like to ask Hannah during this time? You're welcome to raise your hand. I can unmute your mics if need be. Anyone? No, it doesn't look like anyone has any questions. I'm going over the comments, and I will definitely forward over the PowerPoint to those that have requested it. And also, if anyone has any questions, you're welcome to send them to healthcouncil@bhec.bm, and we can forward those on to Hannah. She'll be happy to assist you. Wait, I do have a question here. Is there any food that is especially good for healthy lungs? This is from Dr. Breathley.
Okay, in terms of specific foods for healthy lungs, no, not specifically for healthy lungs. If anybody has things like asthma, then making sure that they're taking their preventative medication, their preventative inhalers. Some people who already have lung conditions such as COPD or pulmonary fibrosis or something would be more at risk of malnutrition because of the increased energy expenditure. So really keeping on top of sufficient calorie intake, sufficient protein, things like that, but not any specific food individually.
Okay, and also with canned foods, we know that they're typically high in sodium. Do you have any other suggestions? I know that some people have tuned in a little later, but can you just provide other options?
Yeah. So, I mean, canned foods, you've just got to read the label. Not all of the canned foods are really high in salt. Some of the varieties, especially the varieties that are coming in from Europe, are going to be lower in sodium than the US versions of food, just because the legislation on sodium content is different in the European Union. So those foods are going to be less. But dried foods are of course low in salt, and some of the frozen fruits and vegetables do not contain any additional salt. So if you've got a freezer, then they're a good option too. And of course, if you're talking fruits and vegetables, using your local farmers here on island and getting the fresh stuff, supporting your local business is going to be the best way.
Perfect. And one more question: does alkaline water matter during this time?
No. Your body is going to control its own pH. It doesn't really matter what you put into your stomach in terms of the acidity or the alkalinity of the water or anything like that. Your pH in your stomach is going to remain the same.
Perfect. Alrighty. Just to remind everyone, the audio version of this session will be provided on our social media channels. We do have a central hub on YouTube that our previous sessions are on. And again, you can send your email to us and we'll be happy to provide all of this information.
Yeah, and if anyone has any specific questions, they're also able to email us at Island Nutrition. We have two email addresses: reception@islandnutrition.bm, which goes to all of our dietitians, so you get a quicker response on that one, or my personal one, which is info@islandnutrition.bm.